Today, we're moving distally to the ankle and foot, which together function as one of the most mechanically sophisticated systems in the body during gait. The ankle and foot complex has to do something that seems contradictory. It must be mobile enough to absorb shock and adapt to terrain. Then it must be rigid enough to generate propulsion. And it has to switch between those roles within milliseconds. If the knee is the shock absorber, the ankle and foot are the translator. They determine how ground forces are accepted, redirected, and returned to propel the body forward. By the end of this lecture, you should be able to first describe normal ankle and foot kinematics and kinetics throughout gait. Not just motion, but force and timing. Second, explain how ground reaction forces influence ankle and foot behavior, especially plantar flexion and dorsiflexion moments. Third, relate center of mass displacement to ankle and foot mechanics, because inefficient ankles mean inefficient gait. Fourth, recognize muscle activation patterns using EMG, especially tibialis anterior, the gastrocsoleus complex, the peroneals, and intrinsic foot muscles. Fifth, analyze common ankle and foot gait deviations, why they happen, and why they matter clinically. And finally, apply this information to real-world PT decision-making, not just lab-based gait analysis. The ankle and foot complex have four major responsibilities during gait. First, it provides shock absorption at initial contact, primarily through controlled plantar flexion and pronation. Second, it allows controlled tibial progression during stance, which is essential for forward movement. Third, it creates a rigid lever at terminal stance so that the force generated proximally can actually move the body forward. And fourth, it ensures toe clearance and proper positioning during swing to prevent tripping and inefficiency. A clinical pearl: if the foot never becomes rigid, push-off is weak. If it never becomes mobile, shock absorption is poor. Both lead to compensation upstream. At initial contact, the ground reaction forces pass posterior to the ankle, creating an external plantar flexion moment. This must be controlled eccentrically by the tibialis anterior. During mid-stance, the ground reaction force shifts anterior to the ankle, creating an external dorsiflexion moment. This is controlled eccentrically by the gastrocsoleus complex, allowing the tibia to advance smoothly. During terminal stance and pre-swing, the ground reaction force initially remains anterior, then shifts posterior as push-off occurs, allowing rapid plantar flexion for propulsion. Every ankle deviation you see is essentially a failure to control one of these external moments. Vertical ground reaction force causes approximately 5 centimeters of vertical center of mass displacement during normal walking, with the peak occurring around mid-stance. The ankle and foot complex helps smooth this oscillation through two things: controlled pronation early and controlled plantar flexion late. Without proper ankle function, vertical oscillations increase, which raises energy cost. An inefficient ankle makes the entire gait pattern more expensive, even if strength is quote-unquote normal. The ankle and foot play a key role in managing center of mass displacement. Early stance pronation allows the body to lower smoothly. Late stance push-off helps redirect center of mass upward and forward. Excessive stiffness or collapse disrupts this rhythm and forces compensation at the knee, hip, or trunk. EMG studies consistently show predictable patterns. Tibialis anterior, eccentric at initial contact, concentric in swing. Gastrocsoleus, eccentric mid-stance, concentric terminal swing. Terminal stance. Perineals, stabilize lateral ankle during stance. Tibialis posterior and intrinsics, stabilize medial arch during push-off. Timing matters more than peak strength. Poor timing will equal poor gait.